Hey everybody, happy Friday and welcome to your Hometown Medical Minute. I'm your host, Hal Brock. Ed, man, we got a chilly one today after such a nice day yesterday for Valentine's Day. Of course, I'm talking to Mr. Ed Harrison, the man behind the cameras, doing all the technical stuff. Ed, did you guys have a good Valentine's Day yesterday?
Yeah, we had a good one.
Good, man. We had a good one. Wife cooked dinner, man. We had a 4-year-old, so we put him down. We're going to go out this weekend. I made up for it. I took Roses to her office yesterday. We did some gift exchange, so I think I did all right. But hey, cool show today. A very important topic, Ed, especially for our area, neck and back pain. And today, chiropractor Dr. Ludwell. He's going to drop in and we're going to talk about neck and back pain and the prevalence here in the state of Oklahoma, especially rural Oklahoma. In fact, Ed, 8 out of 10 Americans will suffer from neck and or back pain at some time in their life. And here in Oklahoma, Grady and Caddo County, that number is closer to about 90%. So, man, it touches near everybody in one way or the other, and it's very serious. We take it very serious here at Southern Plains. We actually collaborated with the Oklahoma Spine Hospital out of Oklahoma City and started the Spine Center here at Southern Plains Medical Center in Chickasha. That's going. We're also collaborating with people like today, like my guest today, Dr. Ludwell, working on chiropractic care, maybe some preventative care. And so I'd like to go ahead and introduce our guest, a man who does a lot, gives a lot of himself to our community, chiropractor Dr. Ludwell. Dr. Ludwell, man, thanks so much for coming.
Hey,
man.
Thanks for having me.
Taking your time. I know how busy your practice is. You're a busy guy.
It's good, though.
Yeah, no, it's a good thing, right? Man, you take care of a lot of people. You know, we're very happy to have you here. Of course, kind of a non-traditional model, a little bit, having chiropractic care inside kind of a multi-specialty clinic. And I have just seen some wonders of having you here with your patients and with our patients, and you're providing the care that people are seeking and that people want and desire, and we're treating people preventatively, and then they can see the for the episodic side as well. Yeah. So
it's been a good mix.
A really cool mix, and you're so pleasant. He's so cool, man. One of my favorite people to have around. Ed, he's hilarious. I get to pal around with him every now and then, so I'm pretty lucky. So hey, just kind of step back a little bit, man. Yeah. What kind of got you into chiropractic?
You know, this is a funny story. I didn't believe in chiropractic growing up.
Really?
I did not. And not until I was had gotten through with my undergrad at OU.
Okay.
And things started kind of making sense with the human body because I was an exercise science major.
Okay, so that explains it. Okay.
Went into training, and then things started making sense. And then with some previous injuries I had in high school sports, I started going to chiropractors and getting treated and getting better. So yeah. I thought, okay, there is something to this.
For sure.
So here I am.
Man, you said that some of the injuries you had in high school sports, I did the same thing. My dad I went to a chiropractor starting at 8 years old.
Oh.
And for some of the injuries that I had, you're getting paged right now and it's on the live stream, but that's cool. If you would, just call them back. I think we got this. No, but
want me to pause it and restart that?
No, we're good. Okay. And but with some injuries and started going to chiropractor at 8 years old, I had a little scoliosis. And then I played baseball at UTA, and so that kept with it. I was a catcher, and you have no idea the back pain, the scoliosis affected my knees and my joints and everything about me. And
especially the catcher.
Yeah, and chiropractic care was the only thing. I went every week and before every game.
During season.
Yeah, during the season.
And it's funny you mentioned that too, because I tell my patients who have children that play sports, during season, it's great to get adjusted once a week. In the off season, maybe once a month, but it's great for preventing injuries.
Man, I think so too. Yeah. I agree.
Yeah.
And so you've been here at Chickasha, and I talked to Carrie earlier because I wanted to get a little background on you. So
she's awesome.
Got some dirt. She's awesome.
She's awesome.
You got a great team here.
Yeah.
Ludwell Chiropractic here at Southern Plains, 2222 West Iowa, 224-4400.
Correct.
All right, cool. So what brought you? So you became a chiropractor after kind of going through some exercise science stuff. What brought you to Chickasha?
Well, I was born and raised here. Okay. So I kind of wanted to come back just to help with the the sport. I was more sports oriented than just a traditional chiropractor. Right. So and that's kind of changed over the years. I'm staying with sports, but it's also nutrition. So I wanted to come back and help the the high school and or the colleges, as
Yeah,
well.
right.
So I came back I was in Kansas City for school and practiced a year up there.
Okay.
So I came back in 2008.
Okay.
Is when I opened my practice here.
Man, that's really cool.
Yeah.
That's really cool. And
it was exciting. I opened it on my oldest son's second birthday.
No
so
way.
I opened my doors. Yeah.
Wow.
Yeah.
How cool. Now, how old is your son now?
He's 12.
Wow.
So yeah, this summer will be 11 years.
That's cool.
In practice.
He's gotten to watch your whole progression, and I've gotten to see you work with some of the athletes and some of that, and I think that's something that's very special here in Chickasha, because you mentioned, getting to work, not only where you're from, and so you get some of that small town, but you also mentioned college, USAO,
right.
And having the high school, very high competitive here in Oklahoma, Southwest Oklahoma. I call the Chicks football games, they're competitive.
Right.
So it's kind of a cool area,
yeah.
And that you're from here. That's a pretty cool little mix.
Yeah.
So what type of neck and back pain do you kind of see most often?
It's used to maybe 8 to 10 years ago.
Yeah.
And before I was in practice, before that, stats would tell you that we see probably 80 to 85% of the patients that walk in your door, you're going to treat a low back.
Okay.
And we still do. And in this area with all the farmers and the ranchers and the oil field workers and the pipeliners, we see a lot of low back issues.
For sure.
Just stepped out of one right now.
Really?
Yeah. And
see, I take people out of patient care, by the way. I'm so sorry. No, but we were talking about that before you got here, and I guess I never clarified why we're a little bit higher than the national average. So 8 out of 10 Americans will suffer neck and back pain through their life. But in Oklahoma, specifically rural Oklahoma, we're closer to that 90%.
Yeah.
Because of what you just mentioned, industries like farming, ranching, oil and gas, manufacturing.
So we're seeing a lot of that, but here's kind of a weird transition I'm seeing now is I'm seeing a lot more neck and upper back pain.
Okay.
And there's been some studies done out on the West Coast, and which they've coined a term called text neck. So
wait, because people are. I mean, that makes sense. Because if you think about it. And I'm in business development, and this sounds it sounds bad, but I'm always on this stupid thing.
Yeah.
And I say stupid, we're not sponsored by Apple or anything, but no.
Right.
So text neck.
Text neck.
That's a for real thing now.
That's a for real thing now. So, which makes sense because we're seeing it in younger people.
Yeah.
And 87% of teenagers from 14 to 18 have and use smartphones.
For sure. I think my 4-year-old, he plays on his tablet.
He knows it better than you probably.
Yeah, for sure.
So we're in this position where the head's down.
Yep.
The arms are down. So I'm seeing a lot of new neck, upper back headaches.
That's crazy.
Yeah. So it's transitioning. We're still treating low back.
Yeah.
I think we always will.
For sure.
With the area we're
Especially
in, the region we're in, right? So, but I am seeing some new issues.
Well, and if you think about it, not only just your phones, but the other half of my job is I'm on a computer, I'm sitting in a chair, my neck is constantly either on this screen, on that screen.
Right. Exactly.
And I mean, I'm not going to lie, I need a chiropractor. I saw Ed just adjusting him, so I think he just got 2 new patients. We might need to go. So I know I'm trying not to take up your whole day, and so I know you've got some patients, but I know you do some other cool stuff, and there's some misnomers out there in between some chiropractor and some traditional care. Anything you want to can clear up for us of the misnomers? Because I personally believe in chiropractic care. I love getting adjusted. I love the feeling, the pressure releasing, and you just. It makes me feel better.
You do feel. I feel better. When I get adjusted. I guess one thing I could say is chiropractic is probably the most widespread, non-invasive, drug-free therapy that is used to address any neuromusculoskeletal issues.
For sure.
At very low risk. There's not much risk involved in chiropractic care, which is awesome.
That's amazing.
So when we perform the manipulation or the adjustment, we're introducing motion into that segment. So, and that comes with a plethora of things like increased range of motion, decrease or increase nerve conduction.
Right.
So, decreases pain. So, right there, in one fell swoop, with one chiropractic adjustment, we're treating the issue and decreasing the pain.
It's so awesome, and you hit another nail on the head. I mean, you mentioned medicine free and opioid free, and not that. I mean, and I think some doctors. I'm in medicine. I think it's heavily scrutinized. I think some patients do need that, and these doctors try everything. I mean, we're more interventional pain here, so we do a lot of stem treatments and a lot of injections and things that go away from opioids. But you still have to have your treatment programs, and you have to be lined up for that, and I think they're kind of heavily scrutinized, and I think our doctors do a great job, but I think everybody, even the people that have to have the opioids, would rather have something where you don't, and
That's a good point, and my theory is I think I'm pro-medicine. I think we need medicine. A lot of chiropractors would disagree with me. Right. But I'm in a situation where if we could start most conservative, non-invasive, let's start here, because you have nothing to lose. Right. If it helps you, great. We didn't have to take the next step. Yeah. So, but if not, we have that available here, and we can take care of the patient. And I think that's what's great about this relationship and having chiropractic care with us, because you're right. It's about everything. It's about taking care of a patient totally, and not just in what might work for somebody, even if it's perception, if it's reality, if whatever it is, if it's medication, if it's stem treatment, whatever works for that person works for that person. And so having these options, and like you mentioned, having preventative options. And I need to do a better job in the community of just educating people, because most of these things, like if they came to you prior to having back issues and they were aware and educated on the system, and they went to their primary care physician regularly, a lot of these things can be prevented through methods like having you on here. And it's going to take some steps. We're going to strive to do better, myself included. I think the last research article I read is only 11 to 13% of the population will visit a chiropractor. Wow, yeah. But we have 90% of people hurting. So where's the balance? Yeah. And I would love to try to help somebody conservatively and non-invasively before they went the extra step. For sure. So, and the other misconception or issue that I hear a lot is, what about the popping? Okay. What about the popping? Yeah, what do you hear about that? Everybody's afraid of it. They think it's bad. Yeah. No, that's so funny. I mean, my wife even said she worked at a chiropractic office years ago, and she used to say that. I've never kind of had that fear because I went so young and my dad took me, and so I just knew it was safe, and I just got that good feeling. Yeah. But some people are afraid of it. They're afraid of it. But it doesn't hurt. No, it doesn't. At all. No. And actually, it's a release. Yes. So the popping, quote unquote popping that you hear is kind of a byproduct of the manipulation or the adjustment. Movement. What it is, movement. Yeah. So what it is, every joint we have in our body is surrounded by a capsule. Okay. Fluid-filled capsule. And there's little air pockets. So when you stress to get that joint to move, for sure, that air will release. And that's the pop you hear. So there's no bones slamming. It's not slamming. You're not building a fire or anything. No, exactly. You're actually letting the air out, and so that fluid can move a little bit more smoothly within that little capsule. Yeah, the pressure just releases, and it takes some of the inflammation off. That's why you get increased range of motion, decreased pain, and with each adjustment. So, and a chiropractic adjustment is a very specific, what they call a short lever adjustment. It's a very fine-tune, what they call a high-velocity, low-amplitude thrust. Okay. So it's a very safe technique. That's awesome. Yeah. So the popping, no worries with the popping. Man, wow. Well, I have none. You should have none either. Guys, Chris, man, thanks so much for coming. Yeah. Come and check this man out. I'm telling you, you will walk away feeling 90% better than you did before you knew the man. 2222 West Iowa here in Chickasha, 224-4400. Hey, come back next week. Exciting show for you guys. Optometrist Dr. Sean Hajari is going to be here. Norman native. It's going to be very fascinating. Eye Things Ed always gets my attention. So come back next Friday.
for your Hometown Medical Minute.